Right now I'm in the prep station. I'm going to go ahead and wash my hands with some hand sanitizer. I'm now going to scan my patient's box here, Annie Jackson. And this is going to bring me to her EMR.
We'll see if it works. So now, here's your metoprolol. It says you have 100 milligrams of okay, so spring water. Give it
Alright. And after looking at her EMR, it says that she needs omeprazole. And she needs 40 milligrams. These tablets are 20 milligrams, so I'm going to go ahead and give her 2 tablets of omeprazole. So I'm going to place that in a med cup. And then Annie also needs insulin. She needs regular insulin and also, let's see, and NPH insulin. So I'll go ahead and find those. Okay, so I found the regular insulin. And also the NPH insulin. And I'm double checking those against the EMR. Okay, so for the NPH insulin, I need 10 units. And for the regular insulin, since my patient's glucose level is at 300, I'll need 4 units of the regular insulin. And lastly, my patient needs the influenza vaccine. I'm going to check that against the EMR. And they need 0.5 milliliters of that. Alright, so that was my first check. Now I'm going to go ahead and get the medications ready.
Now I'm going to administer her hepatitis B vaccine and the Deltoid, which is intramuscular injection. Alternative sites for intramuscular injections are dorsogluteal, ventrogluteal, vascular.
So first I'm going to prepare the insulin syringe. I know that for the NPH insulin, I need to rotate it between my hands to mix it. And then I also need to swab the top of both of the insulins. I'm going to use a different alcohol swipe for both of them. First, I'm going to inject 10 units of air into the NPH insulin.
As long as I did everything with the bowl. Yeah. And then I hand sanitize.
And now 4 units into the regular insulin.
And like, let me know if you have any discomfort with that vaccine.
I'm going to draw up the regular insulin.
Scan through it one more time. If I do bad.
Now the NPH insulin, 10 units.
There's like a lot of powder on their tongue. I guess we can film it online. However, like, I can video what it is.
And now I'm going to recap that using the scoop method. And I'm going to make the label for that syringe.
Any help, Laura? Oh, I don't know. Practice? Do you want any input? fill mine and then we'll follow along and make sure you don't miss anything. I'm gonna open the glasses like ahead of time. Okay, not like so that it's
Yeah, but no, we need that like sticky stuff to put this on the whole just in place.
the butterfly. That's what I just look like.
Yeah. I'm gonna put that label on my syringe. And I'm also then gonna check that against my EMR again, and this will be my second check.
Metroprolol.
So that looks good.
Metroprolol. Metroprolol.
Is there more?
What's Metroprolol?
Okay. Next, I'm going to prepare my influenza vaccine.
Can't you just use the tape?
No, she what was your blood sugar this morning? Or should you guys should say her blood sugar? Yeah. It looks like she's the blood sugar was 90. What? My blood sugar was 190.
Okay, again, I'm going to clean the top of the influenza vaccine.
Yep. Okay.
I'm going to drop back 0.5 milliliters of air and inject that in to the vaccine. And now I'm going to draw back 0.5 milliliters.
Everyone just take something. This is a high roller. They have all the stuff over there. It's for hypertension.
Okay, make sure there's no bubbles present. I'm again gonna recap this using the scoop method, and then make a label for this one as well. Now I'm gonna check the influenza shot against the EMR, and this will count as my second check. That looks good. So now that all my medications are ready, I'm going to head into the patient's room. Hi, my name's Erica. I'm going to be your student nurse today. How are you doing?
Doing good.
Good. Can I have you state your name and date of birth?
Annie Jackson, April 10th, 1976.
Okay. And it says you're allergic to Toradol.
That's correct.
Okay. Do you have any other allergies?
No.
Okay. Well, today none of the medications I'm going to be giving you contain Toradol, so we should be just fine. Alright. I'm going to go ahead and scan your wristband before I give you any medications. Okay. I'm going to go ahead and put on some gloves. Okay, first I'm going to give the omeprazole, and I'm going to go ahead and do my third check against the EMR, and again, it's 40 milligrams of omeprazole.
You want to make sure it's dry, completely dry before you go ahead and start your medicine.
Right here I have your omeprazole. Omeprazole is a proton pump inhibitor, and that's going to decrease the acid in your stomach. Are you in a comfortable position? Good. And would you like a drink of water beforehand?
After.
Okay. Here's your pills. Thank you. Did those go down all right? Okay. Next, I'm going to go ahead and give the influenza shot. I'm going to again check the prescription against the EMR for my third check, and it looks good. So since this is an intramuscular shot, I'm going to go ahead and give it in the deltoid. On the patient, I'm going to find the chromium process, and then I'm going to place 3 fingers under it. Go ahead and make a triangle, and I'm going to know to give it right in the center of that triangle. For intramuscular shots, you go in at a 90-degree angle. I could also give an intramuscular shot in the vastus lateralis. And before I give the shot, I'm going to go ahead and wipe the area from the inner out aspect to the outer aspect. I'm going to wait for that to dry. Okay, now that it's dry, I'm going to go in at a 90-degree angle, holding it as a dart. Slowly inject the medication. Hold it. Take it out. I'm going to put the safety guard on. And I'm going to put that in the sharps container. Lastly, I'm going to give insulin. And I'm going to check this against the EMR. I'm also going to scan it in. And this is my third check, and it looks good. So insulin is going to be given in the subcutaneous region. Today I'm going to give it in the abdomen, so it'll be below the costal region and above the iliac crest. I could also give this in the posterior aspect of the arm and also on the vastus lateralis in the thigh region. So first, again, I'm going to swab the skin from the inner to outer. I'll let that dry. And for subcutaneous, you can either give it at a 45 or 90-degree angle, depending on the patient. I'm going to grasp the skin, and today I'm going to give this at a 90-degree angle. Insert it. Slowly put it in. Hold it in for a little bit. Take it out in the same angle. And then dispose that in the sharps container. I'm now going to take off my gloves, wash my hands again, and I'm going to double check my documentation. And the documentation looks great. I'll then let the patient know and also be watching to see if there's any adverse effects from the medication that was given.